Hello, my friends. This is Dr. Mandell. If you're over the age of 60, listen carefully. Walking is a great exercise. It keeps your joints moving, helps your heart, and clears your mind. But what if I told you there are 5 specific exercises that can actually do more for your body than just walking alone? These are simple, surgeon-approved, joint-friendly movements that can protect your muscles, your bones, and your balance, and help keep you independent as you age. The truth is, after 60, our body starts losing muscle mass. This is called sarcopenia, and when muscles shrink, balance gets worse, bones get weaker, and the risk of falling goes way up. Walking alone won't stop that process. That's why we need targeted movements that strengthen, stabilize, and rejuvenate the body. I want to share something very important with you today. Many of you believe that walking is the gold standard when it comes to exercise, especially as we get older. And don't get me wrong, walking is wonderful. It gets you outside, it helps your circulation, it clears your mind, and it's gentle on the joints. I encourage all of my patients, my family, my friends to walk every day. But here's the truth that most people don't realize: walking alone is not enough once you pass the age of 60. Now, why is that? The body begins to change in ways that we can't ignore. After the age of 30, we slowly start to lose muscle mass. And by the time we reach 60, this process of muscle decline accelerates. It has a name: sarcopenia. This is the gradual loss of muscle fibers, strength, and function that comes with aging. And my friends, this is no small problem. Sarcopenia can rob you of your independence. It can weaken your bones. It can throw off your balance, and it can set you up for falls, injuries, and a cascade of health problems that follow. Walking is a form of cardiovascular exercise. It gets the heart pumping, and that's a wonderful thing, but it doesn't provide the kind of resistance, the kind of muscle activation, and the kind of balance training that our aging bodies desperately need. Think about it. When you walk, you're moving your body in the same repeated motion, step after step. Yes, your legs are working, your heart is working, but are you really strengthening your thighs, your hips, your calves, your back, your arms? Are you improving your balance to prevent falls? Are you loading your bones to keep them dense and strong? The answer is no. Walking simply cannot give you all of those benefits. And this is why I want you to open your eyes and see the bigger picture. If you are over 60, you need to think about exercise differently. It's not just about getting steps on your fitness tracker or taking that 20-minute stroll around the block. It's about protecting your future. It's about maintaining the strength to get out of a chair without struggling. It's about keeping the stability to climb stairs without holding on for dear life. It's about being able to lift your groceries, play with your grandchildren, and feel confident in your own body. Walking alone won't give you that, but the right exercises will. When you perform movements that challenge your muscles, even gentle, simple movements, you stimulate the muscle fibers. You remind them that they still have a job to do. You prevent them from withering away. You activate the nervous system, keeping those signals sharp and responsive. You strengthen the connective tissue that holds everything together, and you keep your joints lubricated and flexible. Walking just doesn't provide enough of that stimulus. Think about your bones. Osteoporosis is another silent thief of aging. Bones become brittle and weak, and the risk of fractures goes through the roof. What makes bones strong? Resistance. When muscles pull on bones, when the body is challenged against gravity, the bones respond by getting denser and tougher. That's how nature designed us. Walking does load the bones a little, but not nearly enough. It doesn't challenge the hips, the spine, or the upper body in the way that targeted, surgeon-approved exercises do. And let's not forget about balance. Every year, millions of older adults experience falls. And those falls often lead to broken hips, long hospital stays, and a loss of independence. Walking does not train balance. Balance comes from practicing stability, from challenging your body in ways that force the small stabilizing muscles to work, from holding positions, from shifting your weight, from strengthening the ankles, the knees, and the core. Without balance training, the risk of falling skyrockets, and that is something walking will never fully prevent. I want you to picture this, two people, both 70 years old. One walks every day, 2 miles around their neighborhood. The other walks 2, but also spends 10 minutes a day doing simple, surgeon-approved strength and balance exercises. Which person will be stronger? Which one will have more muscle tone, more confidence, and a lower risk of falling? Which one will still be able to climb stairs and get out of a chair easily at 80 or 90 years old? My friends, you know the answer. It's the person who went beyond walking. And this is why I'm so passionate about teaching you these movements. You don't need fancy equipment. You don't need a gym membership. You don't need to spend hours sweating. All you need are a few minutes a day, the willingness to move your body, and the understanding that your future health depends on the choices you make today. Walking is great for your heart, your lungs, your circulation, and even your mind. But it's not enough to stop sarcopenia. It's not enough to protect your bones. It's not enough to give you balance and coordination. My goal is not to replace walking. Absolutely not. I want you to keep walking, but I want you to build on it. I want you to combine walking with targeted exercises that strengthen, stabilize, and rejuvenate your body. That combination is what will keep you moving gracefully, confidently, and independently for many years to come. So please don't fall into the trap of thinking that walking alone is the magic solution. It's only one piece of the puzzle. Start adding in these movements and you will notice the difference in the way you feel, the way you move, and the way you live. And when you feel stronger, when you feel more stable, when you feel more confident in your body, that's when life truly opens up again. I want to talk to you about something that seems so simple, yet it is so powerful for your health as you get older. It's an exercise that doesn't require equipment, doesn't require a gym, and you can do it anywhere, anytime. Heel raises. Now you might be thinking, Dr. Mandell, how can lifting my heels off the ground be so important? But I promise you, once you understand how this movement works in your body, you'll see why it's one of the most valuable things you can do after the age of 60. Let's begin by understanding what happens to the lower part of our body as we age. The calves, those muscles in the back of your lower legs, are often referred to as the second heart. Why? Because every time you contract those muscles, they squeeze the veins and help push blood back up toward the heart. When you're young, these muscles are strong and responsive. They pump that blood upward with ease. But as you age, if you don't use them, they become weak. And when they weaken, circulation suffers. This is why many older adults experience swelling in their ankles, cold feet, or a heavy, tired feeling in the legs. Now imagine what happens when you start training those calf muscles again through something as simple as heel raises. You're not just strengthening the muscle, you're reviving your circulation. You're helping the veins push that blood upward, reducing swelling, improving oxygen delivery, and lowering the risk of clot formation. In fact, many surgeons and medical specialists recommend this exact movement after certain surgeries because it's one of the safest ways to encourage circulation without straining the body. That's how powerful it is. But circulation is just the beginning. Heel raises also target one of the most overlooked areas in the aging body, the ankles. Do you realize how important your ankles are for balance? Think about it. Every time you walk, every time you take a step, your ankle joints are the first point of contact with the ground. If the ankle is weak, unstable, or stiff, it throws off everything above it, your knees, your hips, even your back. One wrong step on an unstable ankle can send you tumbling to the ground. And falls, my friends, are not just accidents. They are the #1 reason older adults lose their independence. A fall can lead to a hip fracture, months of recovery, and often a decline in health that is hard to reverse. By practicing heel raises daily, you're not just exercising, you're actively protecting your future. You're building stronger ankles, stronger calves, and stronger stabilizing muscles that keep you upright and steady on your feet. Let me give you a picture. Imagine standing in your kitchen holding onto the countertop for support. You slowly rise up on your toes, squeezing those calf muscles, and then lower yourself back down with control. You repeat this 10, 15, maybe 20 times. What's happening inside your body? Blood is flowing upward. The calf muscles are being challenged. The ankles are practicing stability. The brain is being trained to coordinate movement and balance. And the best part, you're doing it safely. without stress on your joints, without pounding, without risk. This is why heel raises are surgeon approved. They're simple, safe, and effective for virtually everyone. Now here's something else I want you to think about. Strong calves don't just help with balance and circulation, they also make everyday movements easier. Climbing stairs, getting out of a chair, walking uphill, all of these require calf strength. Have you ever noticed older adults shuffling when they walk, barely lifting their feet off the ground? That's not just habit, that's weakness. Weak calves and ankles force people into a shuffle, and that shuffle increases the risk of tripping. But when you train those muscles, you restore the ability to walk with confidence, to lift your feet, to take steady steps. That, my friends, is priceless. And don't underestimate the connection between your calves and your knees. When the calves are strong, they absorb some of the forces that would otherwise stress the knees. Many of my patients with knee discomfort find relief simply by strengthening the lower legs. The body works as a chain. When one link is weak, the entire chain suffers. Heel raises are like oiling one of the most important links in your chain of movement. Now I know some of you might be thinking, but Dr. Mandell, I can't stand very long, or I feel unsteady on my feet. That's okay. You can start small. Hold on to a wall, a sturdy chair, or a countertop. If you need to, do the exercise seated. Extend your legs slightly forward, press your toes into the ground, and lift your heels while sitting. The key is consistency. Even a few minutes a day will start to wake up those muscles, improve circulation, and strengthen your foundation. Remember, my friends, it's not about how many repetitions you do or how high you can lift your heels. It's about sending a message to your body. I still need you. I still want you strong. I still want you to support me. The body listens. The body responds. And the body adapts, even at 60, 70, 80, and beyond. I want you to understand this. Heel raises are not just an exercise. They are an investment in your mobility, your stability, and your independence. Every time you practice them, you're lowering your risk of falls, you're boosting your circulation, and you're making it easier to do the things you love. Whether it's gardening, walking with friends, or simply standing tall with confidence, these small movements have a ripple effect across your entire life. So please don't underestimate the power of this simple exercise. Add it into your daily routine. Do it while brushing your teeth, waiting for your coffee, or standing in line. Make it part of your lifestyle. Because the stronger your calves and ankles are, the more freedom and independence you will keep as you age. I want to share with you one of the simplest yet most powerful exercises for protecting your knees, keeping your legs strong, and helping you stay independent as you age. It's called the seated leg extension. Now you might be wondering, how can sitting in a chair and lifting my leg really do much for my health? But I want you to listen carefully, because what I'm about to explain can make all the difference in the way you walk, the way you climb stairs, and the way you live your daily life after 60. The quadriceps, those muscles in the front of your thighs, are the powerhouses of your lower body. They're responsible for straightening your knee, supporting your balance, and absorbing much of the stress every time you walk, sit, stand, or climb. But here's the problem. After the age of 60, those muscles naturally begin to weaken if you're not actively training them. And when the quads weaken, the knees begin to suffer. The cartilage wears down faster, the joints become unstable, and even simple movements like getting out of a chair or stepping onto a curb can feel like a struggle. I've worked with thousands of patients over the years, and I can tell you that weak quadriceps are one of the leading reasons older adults lose mobility. And what's worse, most people don't even realize it's happening. They think their knees are just bad or arthritic, when in reality much of the pain and instability comes from lack of muscle support. The joint alone cannot carry all that load. It needs the muscles around it to act like shock absorbers. That's why strengthening the quadriceps is one of the most important things you can do to protect your knees and your independence. Now this is where seated leg extensions come in. The beauty of this exercise is that it's simple, safe, and doesn't require standing or complicated movements. You sit in a sturdy chair, you lift one leg until it's straight, you hold it for a few seconds, and you slowly lower it back down. That's it. No weights, no machines, no risk of falling. Yet what's happening inside your body is powerful. You're engaging the quadriceps, you're waking up those muscle fibers, you're improving blood flow to the knees, and you're training the nervous system to stay connected to those muscles. I want you to think about what this means for your everyday life. Every time you stand up from a chair, you're using your quadriceps. Every time you climb a step, you're using your quadriceps. Every time you rise from the toilet, bend down to pick something up or get out of your car, those muscles are doing the work. When they're strong, these movements are effortless. When they're weak, they feel like a chore, and that's when people start avoiding activity, which only makes the weakness worse. It becomes a vicious cycle. But when you commit to doing seated leg extensions regularly, you break that cycle, you give your body the strength to keep moving, you reduce the stress on your knees because the muscles are carrying more of the load. You improve your posture because strong thighs help align the hips and spine. And you protect yourself from falls because a strong lower body means steadier steps and quicker reactions when you lose balance. Let's not forget another important benefit, circulation. When you extend your leg and contract those big quadriceps muscles, you're pumping blood through the largest arteries and veins of the body. This helps reduce swelling, improves oxygen delivery, and lowers the risk of clotting. For older adults who spend more time sitting, this is especially important. You can literally improve your circulation while sitting in a chair just by practicing this exercise. And here's something else that may surprise you. Strengthening the quadriceps doesn't just protect the knees, it also helps the hips and even the lower back. When the thighs are strong, they stabilize the pelvis and reduce strain on the spine. Many people with nagging hip or back pain find relief once they start strengthening their quads. This is because the body works as one integrated system, not isolated parts. When one area is weak, other areas are forced to compensate and pain develops. By keeping your quadriceps strong, you're supporting the entire chain of movement. Now I want to give you a picture of how simple this can be. Imagine sitting in your living room chair, watching television, or talking on the phone. While you sit, you lift one leg straight out, hold it for 3 to 5 seconds, and slowly lower it. Then you switch to the other leg. Do this 10 times on each side, maybe 2 or 3 sets a day. That's only a few minutes, but those few minutes can completely transform the way your legs feel and function. Consistency is the key. If you want to make it more challenging over time, you can add a light ankle weight or even place a water bottle on your ankle while you extend, but you don't need any extra resistance to get results. Your own body weight is enough to wake up those muscles and keep them alive. The most important thing is to do it regularly. Think of it as brushing your teeth. You don't skip brushing because you know it keeps your mouth healthy. In the same way, seated leg extensions keep your knees and legs healthy. My friends, aging is not about giving up your strength. It's about protecting it. It's about training the muscles you rely on every single day. The quadriceps are at the center of your mobility and they deserve your attention. Walking alone cannot give them the challenge they need. That's why exercises like the seated leg extension are so critical. They fill in the gap that walking leaves behind. So I encourage you, start today. Find a chair, sit tall, lift that leg and feel the strength returning. Do it while you drink your morning coffee, while you wait for dinner to cook, or while you read a book. Make it part of your daily routine, and I promise you will feel the difference. I want to share with you one of the most effective and safe upper body exercises that you can do at home at any age, but especially after 60. It requires no equipment, no gym, and no complicated movements. It's called the wall push-up. Now you may be thinking, push-ups, that sounds too hard for me, but I want to assure you, this is not the kind of push-up you did in school. This version is gentle, joint-friendly, and surgeon-approved, and it has the power to strengthen not just your arms, but your chest, shoulders, back, and even your posture. Let's first understand why this matters. As we age, one of the first areas of the body to lose strength is the upper body. The muscles of the arms, shoulders, and chest often go neglected because most of our daily movements involve our legs, walking, standing, climbing stairs. But what happens when the upper body weakens? Simple things start to become difficult. Lifting a bag of groceries feels heavy. Opening a jar becomes frustrating. Pushing yourself up out of bed, off the floor, or out of a chair feels like a struggle. Weakness in the upper body is one of the biggest reasons older adults start depending on others for help. But there's something even more concerning. When the muscles of the chest and shoulders weaken, the body tends to collapse forward. Posture suffers. The head juts out, the back rounds, and breathing becomes more shallow. This hunched over position not only makes you look older, it puts pressure on the spine, the lungs, and even the digestive system. Poor posture can lead to back pain, neck pain, headaches, and fatigue. And my friends, walking alone will never fix this problem. You must strengthen the upper body to hold yourself tall and proud. This is where wall push-ups come in. They are one of the safest and most effective exercises to strengthen these critical muscles without stressing the joints. Unlike floor push-ups, which can be difficult on the wrists, shoulders, and lower back, wall push-ups are accessible for almost everyone. All you need is a wall. You stand about 2 feet away, place your hands flat against the wall at shoulder height, and slowly bend your elbows to bring your chest toward the wall. Then you press yourself back until your arms are straight. That's it. Simple, safe, and incredibly effective. Now let's talk about what happens inside your body when you perform this movement. As you lower toward the wall, the muscles in your chest and shoulders stretch and engage. As you press back, those same muscles contract, building strength and endurance. Your triceps, the muscles on the back of your arms are activated, giving you the power to push, lift, and carry. Your core muscles also switch on, helping to stabilize your spine. And when your core and chest work together, posture improves naturally. You begin to stand taller, your breathing deepens, and your energy rises. Let me give you a picture of how this translates into everyday life. Imagine getting up from a low chair. If your arms are strong, you can push yourself up easily. Imagine reaching into a cabinet to lift a heavy pan. Strong shoulders make it effortless. Imagine catching yourself on a railing if you slip. Strong arms can literally prevent a fall. And imagine standing in front of a mirror with your shoulders back, chest open, and head held high. That's confidence. That's vitality. That's the difference upper body strength makes in your life. I have seen countless patients over the years who complained of back pain, neck stiffness, and shoulder problems. And do you know what I found? Many of them had one thing in common: weak upper bodies. Once they began simple exercises like wall push-ups, their posture improved, their pain decreased, and their mobility returned. It's not magic, it's just the body responding the way it was designed to. When you strengthen the muscles that hold you up, everything starts working better. Now the beauty of wall push-ups is that you can start at your own level. If standing 2 feet from the wall feels difficult, step closer. The closer you are, the easier it becomes. As you get stronger, you can step farther away to increase the challenge. You are always in control. And because you're pressing against the wall rather than the floor, there's no risk of falling or straining your joints. That's why surgeons and therapists recommend this movement so often. It's safe, scalable, and effective for virtually anyone. I also want you to consider how this exercise benefits your bones. When you push against the wall, you're putting gentle stress through your arms, shoulders, and wrists. This stress tells your bones, stay strong. It stimulates bone density, which is critical in preventing osteoporosis. Many people think only walking helps the bones, but that's mainly true for the legs and hips. Your upper body also needs resistance to stay strong, and wall push-ups provide exactly that. Now here's the best part. You don't need to carve out special time to do this. You can make it part of your daily routine. Do a set of wall push-ups while waiting for the microwave. Do them in the morning after brushing your teeth. Do them in the evening while watching television. Just a few sets of 10 to 15 repetitions a couple of times a day will start to transform your strength and posture. It doesn't take hours in the gym, it just takes consistency. My friends, aging does not mean surrendering your strength. It means finding smarter, safer ways to keep your body working for you. Wall push-ups are a gift you can give yourself every single day. They require nothing but a wall and a little bit of your time. And in return, they give you stronger arms, healthier shoulders, better posture, and greater independence. So I encourage you, don't underestimate this simple exercise. Try it today. Feel the muscles working. Notice how your body responds. and make it a habit, because the stronger your upper body is, the more freedom and confidence you will enjoy in every part of your life. I want to talk to you today about something that might be the most important exercise of all as we get older, balance training. And I'm not talking about fancy equipment, gym memberships, or complicated routines. I'm talking about one simple practice that can be done in your home, in your kitchen, even while brushing your teeth, balance holds. This is where you stand tall, lift one foot off the ground, and hold that position. Now you might be wondering, Dr. Mandell, how can something so simple change my life? But I promise you, once you understand the power of balance training, you will see why this one exercise can protect your independence more than almost anything else. As we age, one of the greatest risks we face is falling. Falls are the number one reason older adults end up in hospitals, nursing facilities, or losing their independence. A single fall can lead to a broken hip, months of recovery, and in some cases, a loss of confidence that's hard to get back. And do you know the number one cause of those falls? Poor balance. It's not always weak bones, it's not always bad knees, it's often the simple fact that the body has forgotten how to stay upright. Balance is not something you just have, it's something you must train. It involves your muscles, your joints, your eyes, your inner ear, and your brain all working together in harmony. When you were a child, balance came naturally. You ran, jumped, skipped, and played without even thinking about it. But as you age, if you don't challenge your balance, those systems begin to decline. The muscles weaken, the nervous system slows, and the body becomes less responsive. That's when a small trip, a tiny slip, or an uneven sidewalk can send you to the ground. This is why balance holds are so important. When you lift one foot off the ground, your body is immediately challenged. The small stabilizing muscles in your ankles, your calves, your thighs, and your core all have to wake up and work together. Your brain is forced to communicate quickly with your body, adjusting and correcting tiny movements to keep you steady. You're not just standing on one leg, you're training your entire nervous system to be more responsive, more coordinated, and more protective against falls. Now let me explain why this matters so much in everyday life. Imagine walking across a parking lot and stepping on a small rock. If your balance system is strong, your body will immediately correct itself and you'll keep walking. But if your balance is weak, that little rock could throw you off and cause a fall. Imagine reaching up into a cabinet and slightly losing your footing. Strong balance will allow you to correct yourself. Weak balance could land you on the floor. These are real situations, my friends, and the difference between safety and injury often comes down to whether or not you've trained your balance. The beauty of balance holds is that anyone can start them, no matter your level of fitness. All you need is a sturdy chair or countertop nearby for support. Stand tall, hold onto the chair if needed, lift one foot a few inches off the ground and hold it as long as you can. Even if it's only 5 seconds at first, that's okay. With practice, it becomes 10 seconds, then 20, then 30. Over time, your confidence grows, your muscles strengthen, and your brain becomes sharper at coordinating your movements. And let's not forget, balance training has benefits far beyond fall prevention. It strengthens the core muscles of your abdomen and lower back, which supports your spine and improve posture. It engages the hips and thighs, helping to protect the joints and keep you mobile. It improves circulation because the muscles must contract and release to keep you steady. And perhaps most importantly, it gives you confidence. Confidence to walk without fear. Confidence to step out of your home and enjoy life. Confidence to live with independence. I see many patients who are afraid to leave their homes because they feared falling. They stopped going for walks, stopped socializing, and little by little their health declined. But when they began simple balance training, everything changed. Their confidence returned. Their steps became steadier, and with confidence came freedom. That's the gift balance holds can give you. Here's something else I want you to remember. Balance isn't just about standing still, it's also about moving. Once you feel comfortable holding your balance on one leg, you can make it more dynamic. Try turning your head side to side while standing on one leg. Try closing your eyes for just a few seconds. These small challenges force your body to work even harder, training it to respond in different situations, just like in real life. But always be safe. Keep a chair, a wall, or a countertop within reach so you never put yourself at risk. And don't underestimate the mental benefits. Balance training sharpens the brain. It forces your nervous system to communicate quickly and efficiently. Studies have shown that balance exercises can even help with focus and coordination, which are critical for maintaining independence. When your body is stable, your mind feels stable too. That sense of security reduces anxiety and gives you peace of mind. I want you to think of balance holds as medicine. Just like you might take a pill each morning, take a minute or two to practice your balance. It doesn't take long. Do it while brushing your teeth, while waiting for the kettle to boil, or while watching television. Consistency is the key. A few seconds each day will add up to a lifetime of benefits. My friends, balance is the foundation of independence. Without it, even the strongest muscles can't protect you from a fall. But with it, you can walk with confidence, climb stairs with ease, and move through life with freedom. Walking is wonderful for the heart, but it doesn't train your balance. That's why adding balance holds to your routine is so critical. So I encourage you, start today. Stand tall, lift one foot, hold it steady, and feel your body working to keep you upright. Celebrate every extra second you can hold. That is progress. That is strength. That is your future independence being secured with every practice.